Hi, I'm Dr. Sarah Bonza, board-certified family physician and founder of Bonza Health. Today, we are talking about one of the most debated topics in women's health. Does menopausal hormone therapy increase your cancer risk? If you are confused by the headlines or you are worried about your personal or family history, you are not alone. Let's break down some of the latest evidence so that you can make informed, empowered decisions for your health. Why the confusion? For decades, women have been told that hormone therapy is dangerous, especially for breast cancer. Much of this fear traces back to the Women's Health Initiative study from over 20 years ago, which linked hormone therapy to increased breast cancer risk. But here's the truth. Not all hormone therapy is the same. Newer research, including work by leading oncologists like Dr. Avram Blooming, shows the story is much more nuanced. Let's start with estrogen-only therapy. If you've had a hysterectomy and use estrogen alone, large studies and meta-analyses show no increased risk of breast cancer. In fact, estrogen alone therapy may actually reduce your risk of developing breast cancer by up to 23% and lower your risk of dying from breast cancer by 40%. This is a game changer for women with severe menopausal symptoms and no uterus. What about women who still have a uterus? Estrogen plus progestin therapy. To protect the uterine lining, estrogen is combined with a progestogen. Here's where it gets important. Synthetic progestins, the type used in older studies, are linked to a higher risk of breast cancer, especially with long-term use. Micronized bioidentical progesterone appears much safer. Studies show little to no increased breast cancer risk when estrogen is combined with micronized progesterone, and possibly even a protective effect. So the type of progestogen matters a lot. What about other cancers? Uterine cancer. If you have a uterus, estrogen contributes to the growth of your endometrial layer, which is why using estrogen alone increases the risk without the mitigating effects of the progesterone. But combined therapy of estrogen and progestogen protects against uterine cancer. Ovarian cancer. There is a small but increased risk. It's rare, about one extra case per 1,000 women after 5 years of therapy. And the risk drops after stopping menopause hormone therapy. What about colorectal cancer? Menopause hormone therapy may actually reduce your risk of colon cancer. And this is likely because colon cancer is an inflammatory type of cancer, and estrogen and progesterone can help decrease inflammation in your body as you age. What about cervical cancer? Menopause hormone therapy is considered safe as cervical cancer is not a hormone-driven cancer. Cervical cancer is related to the human papillomavirus, which is a sexually transmitted infection, which contributes to the growth of cervical cancer. Special populations. For those with a family history of breast cancer, menopause hormone therapy does not appear to increase the risk for women with a family history or BRCA mutation, but genetic counseling and counseling before taking menopause hormone therapy is important to make educated decisions. Breast cancer survivors. Generally, menopause hormone therapy is not recommended, especially for hormone receptor positive cancers. However, in rare cases like hormone receptor negative cancers with severe symptoms and failed non-hormonal options, menopause hormone therapy may be considered after a thorough discussion with your oncology team. Genetic syndromes such as BRCA and Lynch. Menopause hormone therapy is contraindicated due to high cancer risk. Those women who have BRCA gene mutations are at risk for breast cancer and ovarian cancer. Those women with a Lynch gene mutation are at risk for colon cancer and uterine cancer. Here's what you need to know. Estrogen alone is generally safe for women without a uterus and may reduce breast cancer risk. If you need a progestogen, choose micronized progesterone over synthetic progestins to minimize breast cancer risk. Personalized shared decision-making is essential. Your cancer history, family history, genetics, and symptom severity all matter. Lowest effective dose, shortest duration, and regular follow-up. This is the safest and most widely accepted approach for all medications, including menopause hormone therapy, though we are discovering many women are taking menopause hormone therapy for longer than was originally suggested, and they're doing just fine. What should you do next? Don't let outdated fear keep you from getting relief. Talk to a menopause specialist who understands the latest science and can personalize your care. If you have a complex history like cancer or genetic risk, insist on shared decision-making approach. If you found this video helpful, please like, subscribe, and share it with someone who needs real answers, not just headlines. For more evidence-based guidance on menopause, hormone therapy, and women's wellness, visit www.bonzahealth.com. Drop your questions in the comments. I'm here to help you navigate menopause with clarity and confidence.